One of the positives about the NHS and about the post-World War II settlement, the welfare state, is that our needs are catered for whether we can pay for them or not. And that must never change. We must not be forced into a position where we make life and death decisions based on money. But of course, that is exactly what bureaucrats are doing when they decide which drugs are and are not available on the NHS. And that must surely be wrong. We need a wider scope and significantly more leeway, and that authority needs to be in the hands of the doctors who are prescribing, not the bureaucrats who are proscribing. We need to make sure that there is never a point again where our wealth or our lack of wealth, our wealth or our poverty determines what sort of treatment we get. That's against the spirit of the people who originally instituted the NHS, and that's what we should be proud of. And yet I don't think that's what we've got at the moment. And equally, I don't think that the people who are working in the NHS, the people who are working in the NHS, not the bureaucrats, the people who are doing the work, that is the people who are repairing the machines, the people who are cleaning the floors, the nurses, the doctors, the people who are looking after the supply of the drugs. These people should be paid as much as possible. They should be rewarded for the hours that they put in, for the training that they've undertaken. The Lansbury reforms from the early part of the Cameron period are the bit of the Cameron administration that I think we should regret significantly. That was an attempt to decentralise the NHS. Now, that recognised that the NHS was bureaucratically top-heavy. But instead of trimming that bureaucracy, i.e. paying the bureaucrats less and making sure they just wither and go, the Lansbury reforms divided and subdivided the NHS so one hospital rarely talks to another. It's catastrophic. I know, because the 2 times I was in hospital with appendicitis, which turned to peritonitis because of the delays while the 2 hospitals talked to each other, and when I was being treated for cancer, again, a catastrophe because the 2 hospitals didn't talk to each other, and therefore I was given the wrong blood treatment, and 2 weeks later I exploded and I was back in hospital. My sofa looked like an abattoir, and I was really quite ill. I had enormously good care, but the problem lay with the bureaucratic nonsense brought about by the Lansbury reforms. The only way round this is to trim back the bureaucracy. And in a day, in a year, in an age when we have computers, we should not be reproducing everything on paper. And when we ask for a document, we should get the same document. I asked for a document the other day of my GP, which I'd already seen, and what I got was something completely different and, frankly, incomprehensible. This is nonsensical. This is nonsensical. And we should be able to simply access our records and work out what's going on. We should be able to access a GP and work out what's going on. Sending people to A&E instead of to their GP is nonsensical. Instead of keeping the A&E open all night and staffed by overworked doctors, junior doctors, we should find a way to get those doctors to staff the GP surgeries so that we have doctors on call. So doctors, GPs are accessible in the community. And I think the way to do this is to restore moral rectitude. So the idea that we should ever be asking people to account for how much money they've got before or if they have NHS treatment is nonsensical. But if people have the money, then I think they should opt for private healthcare and do as much as they possibly can away from the NHS. Not because they don't trust the NHS, but because they love the NHS, because they're supporting the NHS, because they're freeing up those beds for people who really need them. And in that way, maybe we can find the breathing space to do some reparation to make sure the NHS is fit for the next generation. I think it's going to take about 10 years to trim down the bureaucracy. But until we do, and unless we do, the NHS is going to strangle itself. Because a large bureaucracy like that simply cannot function. Everybody in the NHS is an employee. There are no NHS bosses. Everybody is an employee. And as long as people realise that egalitarian system is there, it's a very positive system. Very positive system. But it needs help. And that egalitarian system needs to be supported by the patients as well. We, in the community, if we can find a way to reduce pressure on the NHS, then I think we need to take it. One way to do that, I think, would be private healthcare. We need to find a way to give access to everybody for dentistry, for basic health needs, for end-of-life care, for care in the community. All of these things need to go on and they need to be supported by everyone. That means if we can play our part, we should.